What's going on, everyone? Sid Gordon here with the Sid Gordon podcast powered by Core Medical Group, and I have Eric, the CEO of BioXcellerator, former real estate entrepreneur, and decided to change his direction and start a company called BioX, which is the leading stem cell facility, in my opinion, most likely in the world. And it's an honor to have him here. We are figuring out ways for you as the audience to benefit from hormones and stem cells at the same time. And you should really take the time to understand why these stem cells are so effective and how they can help you. So guys, hope you enjoy. What's going on, everyone? I am here today in Boca Raton with a new relationship. His name is Eric Stoffers, and he is the CEO of BioXcellerator. Thanks for coming in, brother.
Yeah, man. It's good to be here.
I am having deja vu right now.
Yeah, me too. But I guess I should, if I haven't said it out loud already, I'm very appreciative of your time and making sure that we get in front of your audience, and then more importantly, the partnership that we've been discussing. Super excited. I
mean, for me, it's a no-brainer, right? So I have tens of thousands of patients that we treat on hormones on an annual basis, all like consistent new sets of eyes on us because of all the marketing that we do and all the growth. And I am a huge believer in stem cells, like huge. And it would be a shame for me not to educate our existing patients on how to be the best version of themselves. And, I haven't been down there yet, which I will be going here very shortly. And I'm just very excited to bring back my journey and to have it all on film to share with everybody so that they have good access to a healthy, legitimate place that really cares like Core does. And before we get too started, your business model, we've never really met. We've never discussed business until probably like a month and a half ago.
Yeah, very short.
Your business model is like your process and the way that your staff works is like identical to mine. It's the craziest thing ever. And I'm like, that's probably a really good sign. Like your coordinators are all over it. They've been fantastic. No one's rushing you on the phone. They pretend you're the only phone call that day, which is like exactly what I teach my internal staff. When you're talking to someone, make them feel like they're the only person that they have to speak to. Of course.
Especially when you're talking to people that are suffering sometimes with devastating diseases. Mm-hmm. This is the most important call that they're going to have that day, that week, that month, maybe for their life at that point.
And they're just dying for a solution. And if you're going too quick, you might oversee something that could really help them. And your staff was just spot on. So congratulations with that.
Yeah, thanks. I mean, that's the blessing of the business is the people that we work with. The people that we have in our company are insanely just empathetic, but also exceptional.
Uh-huh.
Yeah. So
through this podcast, guys, we're going to really get the education of what the differences are, because there's a lot of people there that are saying, oh, you can get the same stem cells in the United States as you can down south. I'm going to disagree. But we're going to get educated on it with some facts today. But before we get started, I always like to really understand the man behind the curtain, the guy that really, runs the place. Like, who is Eric? Like, how was your come up? What do you think the driving factors for you were to really be so dedicated to this space? And why are you such a great businessman?
Well, I appreciate the kind words. Thank you. I think that to answer the question fully, I have to go much further back than just when I started this particular company.
Please do. Start from childhood.
Cool. I've been a serial entrepreneur, lots of failures, a couple of successes peppered in there. Some of the successes started as a kid selling garbage pail kids on the playground. But really, I think what I'm going to point to in starting into the healthcare sector, because I'm not a medically trained person. I have no scientific aptitude, straight business guy. And so early on, I had no aptitude to go into medicine or medical companies. I was in the real estate business. I was the CEO of a real estate investment trust. And I can talk about that transition into medicine in a second. But it goes much further back in the sense that I spent a lot of time with my grandma growing up, and she was a sweet lady that was from the Midwest. I never heard her say a cuss word in her life. She was, very faith-oriented. She never drank alcohol. She was great to the grandkids, spent a lot of time with her. She was a nurse also, so she dedicated her life to helping people. She transitioned into being a pediatric nurse, and then after retirement, she went into helping more people. So her whole life was helping people, but I also watched her get addicted to pills. And luckily back then it wasn't opioids. Otherwise she might have died because of that. But it was allergy medication. So, and back then it was ephedrine. It was very heavy ephedrine. So she was basically on crack. And I don't think she even meth. Yeah.
Meth, because that's the branch chain of that. Now you have to buy it. It's not over the counter anymore in most places.
Back then you could just go to Walmart and pick it off the shelf. So she, the only fight that I had with her when I was starting at 8 years old, and then it went on the rest of my life, was that she wanted me to take these pills. And I had bad allergies. So she was really just trying to help. But I saw her personality change. I hated taking pills. And from the moment that I had this big blow up fight with grandma, I had this adversity to taking pills. Thank God. Because that set me on this lifetime thought process of just being resistant to pharmaceuticals for any reason, which I'm not saying that, the pharmaceuticals aren't miracles, but it put me in the mindset as a youngster, just because of grandma, to be cautious of pharmaceuticals because I saw what it was doing to her. So I think that was in the back of my mind since a youngster. And then leading into the transition into, starting a medical company, I just happened to be in the right mindset at the right time to switch my efforts as an entrepreneur into helping the community and doing something that was a little bit more than just profits. And so that I would say that was the mindset that got me into being in transition.
So it's really weird that I have people on this podcast, and I can tell you people that are on a similar journey to myself, that have morals and really are trying to affect the communities like yourself. 9 times out of 10, we have like the same come up story. I too sold garbage pail kid cards.
Oh, no way.
I swear to God.
When I say this, people are like, what? You're old, bro. What is that?
I did.
No,
I did. I sold that, and I used to get the 5-cent gum and sell single sticks of it for 5 cents.
Amazing.
When I was young, my grandmother also grew me up.
Okay.
And spent a lot of time with her. She was my rock when I was a kid, and she taught me how to work right. She bought a home in Newton, Massachusetts for $17,500 in 1972. A slab home in the ghetto of Newton, which I don't know if you know Massachusetts or not, but Newton now, put it this way, sold the house for $1.7 million.
Oh, wow.
Like 5 years ago, but she paid that house off working at Filene's doing makeup for 30 plus years on a 30-year fixed mortgage at like 17.5%. Ended up paying like $130,000 for the house by the time it was done. But went to work every day. Never complained. Never called in sick. My mom was very similar to that as well. And I learned a lot of things from that. Being at service to others is really how you become successful.
Yeah, that transition has changed my life.
And I was in the mortgage business for 10 years. Owned Infinity Capital, and then transitioned into debt consolidation for 3 years, and then started Core for probably a very similar reason. I didn't want to start from zero every month. I wanted an annuity, and I wanted to be engaging with people. Now, for me, I thought at the time the mortgage business was like the most intense, hardest business to be in, because you're dealing with what? People's homes, their livelihood, right? They worked their whole life for this. But I learned shortly thereafter, the business I'm in now is way more difficult because people are trusting you, especially 18 years ago, 17 plus, that I started this company. There was a massive stigma behind testosterone.
Oh, yeah. Your business was demonized, just like ours is now, for bad reason.
And I want to talk about that, but before I do, can you finish the transition into that? Were you scared? Was there, like, what were the feelings going through you? Like, because transition's a big topic on this podcast.
Okay.
And like the outlier and overcoming and conquering and dividing, even though it's not all about the money, it's just about the mission. And like that transition for me is like a big goal that I had and I accomplished, and I'm really proud about.
Yeah, I can wholeheartedly say that it was, well, again, it's a blessing in my life that I'm in a place where I'm actually helping people. And so when I talk to entrepreneurs, that's something that when people are asking me about business advice or what should I do, and why did you do what you did, a lot of it was mission driven about doing something that was going to help the community. But to your point, that transition was not easy. If you go from a comfortable place where you've been successful in a sector and just completely leaving that for something that I have, quite frankly, no business being in. I would never be able to, put my hands on somebody and be a doctor, right? Because I didn't have that aptitude in school. So yeah, the transition was very tough. And to take it a step further, I wasn't going into a typical modality of medicine where people trusted it or knew it or doctors would recommend it. So all the odds were against me. All doctors didn't recommend it. Nobody that I talked to about it knew about it. It was still a little bit too new. And then also I was forced offshore. I, meaning our company, BioXcellerator, we were forced offshore because we did not want to sacrifice quality. We wanted to give access to the most advanced stem cell in the world. And we found out very quickly that meant we were forced out of the United States. So now I had to go to another country. I don't speak Spanish. And then
you do now.
I do now a little bit.
I just guessed.
A little bit. I've been taking classes, but I'm a Spanish speaker would tell me I didn't speak.
Okay,
I can understand a lot.
Okay, good.
But those early years, if you can imagine. So when I was calling investors, we did a lot of bootstrapping, but there was a point where we had to take on some investors. If you can imagine, this phone call said, "Hey, I'm Eric Stoffers. I don't have a medical background. I didn't have any scientific aptitude in school. I come from the real estate and restaurant background. I'm opening up a advanced stem cell clinic. So it's the most advanced technology on the planet, but it's very expensive. It's not covered by insurance, and doctors don't recommend it right now. It's not FDA approved. Oh, and by the way, we have to go offshore, and it's in Medellin, Colombia, which is at one point the most dangerous city in all the world. Who's coming with me? Do you guys want to invest?" And as you can imagine, I got a lot of hang-up calls. So yeah, overcoming and persevering and having resilience was kind of a core concept of our business.
You get to the end of that phone call and the person's like, "Is there any good news?"
Yeah, exactly.
Yeah, you have me. I'm really driven.
Yeah,
right.
Exactly.
It's funny how, if you asked me 20 years ago, I moved to Florida in 2000, so I've been here for 26 years from Boston. And if you asked me when I started Core what my goals were, it was to run the first HRT clinic, like in Florida, in this area. I was legitimately the first TRT clinic to do strictly TRT, require extensive blood work, require you to see a physician, and require you to do follow-up bloods and really take it as real medicine, because I've been in trouble before as a kid, and I did not want to cut any corners. And as you know, we can all cut corners and make money real quick.
Yep.
I challenge people to do it the right way and try to make money. It's a lot harder.
A lot harder.
And when I would have someone come through the door, it's funny, it would take me 2 hours, sometimes days, to talk to them, just getting their blood work done. And then at the same time, I had Cleveland Clinic sending out all this white paper saying, if you take testosterone, you have a heart attack and a stroke and you're going to die. And then
junk science.
And then
wasn't that just based off of one 4-person study or something like that?
It was crazy. And the worst part about it is they killed a lot of people by doing that. They killed a lot of veterans. They killed a lot of first responders. They made it so it was so scary. They put a black box warning label on it. It was insane. And they put it as a class 3 with Xanax and Adderall, and I don't know if you guys know, but Xanax is pretty hard to detox off of. You can die. It's worse than alcohol. It's in the same category. And I'm like, guys, you're killing me. Plus, you're deterring people from increasing their hormones, right?
Yeah.
And living a high quality of life.
And deterring physicians into educating themselves further to see how they can help their patients.
That's exactly where I was going to go. So I get the stigma completely. So how did you get to this?
So I was the CEO of a real estate investment trust. I was really helping a friend of mine sell a property in Cabo San Lucas. It's as simple as that. It wasn't just a small property. This was 300 hectares on beachfront. It's a big resort property, but it was run down and dilapidated. So we were getting really bad offers, and so he came to me and just said, "Hey, look, I'm looking for some help marketing, and you're in the real estate business and you have good marketing teams, and what do you think? And will you help me out?" And so from that conversation, because we were in Arizona, border state to Mexico, obviously, and what was happening at that time was you were seeing on the news medical tourism. All these people were going from Arizona or California over across the border to Mexico, and they were getting dental work done, or they're getting eyeglasses or plastic surgery or whatever. So I said, "Hey, why don't we why don't we just start marketing to medical tourism providers and see if we can package it and get some dentists and plastic surgeons and see if they can take down this property. And it was really just out of marketing that a group of stem cell scientists came from that meeting, that marketing effort, and said, yeah, we're interested. We actually have to take our science offshore. And this is when I went, what is stem cell therapy? And so this was back in 2013. I had no idea. No, I had no idea what stem cell was. Other than what I saw in the news, I remember, so I was a Superman fan when I was a kid, and Christopher Reeve, was like the guy that was the Superman at that time. And he had that tragic accident where he fell off his horse and he was a spinal cord injury patient. And there was some news about him doing stem cells. So I had heard about it, but I didn't know really enough about it to really make any educated assumption about it even. And so that is essentially the transition point where at that moment I got a deep dive on this company. I did some due diligence on them. I started doing University of YouTube and looking at stem cell therapy. Yeah. And over the course of, I'd say like 18 months or 2 years, they were contacting me saying, hey, we really liked working with you and, do some consulting with us. And so it just sparked my entrepreneurial light bulb to go off and say, you know what, maybe this is a place that we can really help our community. But then also going back to my grandma, this is anti-pharmaceutical. This is getting to the systemic root cause of disease. It's getting to metabolic dysfunction. It's modulating your immune system. It's actually stimulating and repairing the systemic root cause, not just masking it with some type of pharmaceutical product that ends up causing another symptom that ends up needing another pharmaceutical. That's just this big cascade event.
Yeah, I mean, I can tell you right now, we have the ability to prescribe pharmaceuticals here. Obviously, we do.
And they're necessary. I'm not demonizing them too much.
No. I mean, listen, I tell the audience all the time, physicians in the United States are really good for one thing, and that is trauma medicine. We are fantastic with trauma.
Totally. Best in the world.
The best in the world. You look at, we're both surrounded by a lot of guys in the military, right? You look at an 18 Delta. I would rather have an 18 Delta work on me, which is a very, very high-end medic in the Army, Green Berets. I'd rather have that guy work on me probably than any ER surgeon if I was stabbed or shot or had a bad wound, right? Because they are strictly focused on just that type of medicine, right? Now you have a lot of doctors out there that are trying to be so diversified, jack of all trades. Yeah. A great example on my end is a urologist, a GP. A lot of people are like, oh, I'm going to my GP. They call us back. I feel terrible on this testosterone. Well, they give you any supporting meds? No. I really do believe that there is a place for medicine like your medicine and mine if it is really monitored properly and there are checks and balances in place. And I feel like the people that are cutting corners really hurt men like you and I. Yeah. And I truly believe also that if our legislation really understood stem cell, similar to what I went through with the hormones, you would be, swinging from the freaking trees with putting clinics all over the place because it works. And I'm a huge believer. And it's sad. It just comes down to the fact that it's sad and people don't want to get educated, and big pharma would be really upset if you started fixing people, which is a big fact. What are some of the hardest things that you went through in the early stages of starting this business, other than the ones you just put on?
I would say maybe to come back to a point that I think you're kind of dancing around and alluding to in being a business owner in the medical space that doesn't have a medical background. There could be, I think there's no in between. There could be either really good or really bad in that space. I would say we're on the really good side, and here's why. I'm very protective of the medical doctors and the medical professionals and the people that have taken a big risk by coming into this company and taking their medical license that they've worked for their entire life. They've focused their entire life on helping people and getting into this space, their school and everything that they've had to do. In
$1 million
education.
in bills.
Yeah, exactly. But
then you have to be super, super focused on doing the right thing.
But that's why we don't cut corners. Also, as a non-medical professional, I look at that and go, "There's no way I can do anything that is going to jeopardize this person's entire career. So I'm going to do everything, not even just above board or where it's supposed to be, but go with the exception. And so there are people on the other side that are just, business people, purely business driven, and all they see is profits and not people. So to get back to your question, I think that is actually one of the harder things that I had to overcome, in the sense that, we spend a lot of extra money, time, effort, resources on research and development, safety protocols, proving our therapies, following our patients' outcomes, doing clinical trials, observational studies, all the things that cost a lot of money in our business that I don't think there's more than maybe 2 or 3 clinics in the world that really do to our level. And that doesn't hit the bottom line, and that's not good for the investors. And from a business sense, there's some of those business, structural, procedural things from a finance standpoint that if I wasn't in a research and development type company, I would have set aside. And so that was hard for me to make that switch.
Yeah.
But
well, what's even harder is to find like-minded people like yourself to be on the same team as you to do that.
Oh, can't imagine.
Like the investors are like, I want money, what
course,
I mean? And
always.
which is fair.
Sure.
And you're like, well, if I didn't do this, it'd be a lot easier to get these guys paid back, but you have to do it. So now you have to be a really good educator on why you're doing what you're doing for them to understand and to be patient. And
exactly.
I think that's when I started Core, Florida was full of all the pain clinics.
Oh yeah.
It was
terrible reputation here for that.
It was bad, but guess who owned all the HRT clinics? South Beach Rejuvenation. It was these 2 brothers. You probably saw the documentary.
Oh yeah.
And when the feds came in and shut down, I was almost out of business because I couldn't keep up with the guys that are like, here, just come to us and pick whatever you want. We send it to you with upload work, and here you go.
Yeah.
Well, when they shut down all the pill mills, all the HRT clinics went out of business. Mm-hmm. I was the last man standing. It was 2011, and I went from negative, monthly income to positive monthly income like overnight.
Amazing.
Timing was correct. I didn't want to not have the morals that were important to me, and it worked out amazing. But there was a lot of merit in that battle. Like I suffered hard for a long time, that's the journey. The journey is overcoming the objective and keeping your head down and staying positive. And on top of that, the patients can see that, right? And then they come to your clinic after being treated somewhere else, and they're like, "Oh, I got to do blood work." Yeah, I want to keep you alive. I want you to really enjoy your life and this medicine.
Yeah.
But so
that's something actually that our patients, they have a similar kind of aha moment where it starts off as them being annoyed with us, where they go, "What do you mean you're going to ask us more questions, or you're going to call us in a week, and then 3 months, and then 6 months, and then you're going to spend an hour with us asking the same questions that were in our questionnaire? An hour with us is in a physical examination. So it starts where they're kind of annoyed. They're like, "Well, we wouldn't do that in the States. A doctor wouldn't see me for an hour." We go, "Yeah, exactly. We're not going to just look at your records and maybe make a bad assumption that was misdiagnosed before. We actually want to know you and hear about your lifestyle and any changes between the last time you filled out that questionnaire and when you're with me. And we're going to spend some real time with you." So it goes from them being annoyed to them realizing, wait a minute, this is actually how it's supposed to done.
Yeah.
So.
Yeah, I mean, even the funny thing is I have a rule that no one waits in the waiting room or in a room more than 5 minutes.
Oh, that's great.
Because think about when you walk into your GP, right? And there's like diversified people there for diversified reasons. You got one guy coughing on you, one guy bleeding. You're just like, and you're sitting there for an hour and a half. You leave, you go in, you see him for 10 minutes, and then you leave, or her, and you leave, and the next day you're sick, right? It's just like,
exactly.
I like to make that experience, seamless. So, talk to me about some of the things in your life that have been really difficult to manage while running a business overseas like this. Because I mean, as I talk about this in the podcast a lot, the people that you love the most suffer the most when you're a man like yourself that is on this big mission. What are some of the things that you've been up against? What are some of the things that you've done to find that. I don't really want to call it balance because I don't believe a businessman like you and I can really find balance, but that's another conversation. What are some of the things that you feel like you've done really well by managing expectations from people you care about and your business?
So there's two parts, I think, to that question. First, the failure piece was certainly relationships. I mean, that was something that was tough that I really had to focus on. You know, I lost some contact with friends. I was in a long-term relationship that ended up dissolving because of the business. I mean, it was something that in retrospect, I look back and I go, I didn't do my duty to really focusing enough attention on that to make it thrive. But some of the things that I think I've done well because of that is also realizing that, that's something that I have to manage almost as if it is as important as my business, because it is my personal relationships. But the other thing is my own personal health. There was a point at the beginning where my own personal health was the last thing on the list of priorities. When I started seeing relationships, fizzle a little bit, I started focusing on relationships, and then it was business, and then relationships, and and I wanted to make sure, my very important relationships, like with my daughter and family, that those weren't going to be suffering. But then so what I let suffer was my own personal health. And so the transition into going back to, hey, wait a minute, if you're not healthy, none of your relationships are going to be healthy. Your business isn't going to be healthy. There's not an aspect of your life that's going to be healthy if you're not also physically, putting in the work. So I was 50 pounds heavier. I was a fatty.
Fantastic.
I was bad. I actually need some TRT. So over the last couple of years, my levels of kind of like
Didn't you sign up with us? Didn't you get the telehealth?
Yeah. I've just been out of country, so I didn't do the blood test with you guys, but I did one in Colombia.
Okay.
But I think I'm just going to go and do your specific protocol.
Do you have the blood? Do you have the blood work with you?
Now that I'm here in the States, because I just came back yesterday, so I'm going to
after, and I can get you set up.
Yeah, cool.
I want to show you it anyways. So what's funny? One of the biggest objectives we have to overcome here at Core Medical Group, and you're going to probably enjoy this, is a patient will call in, the onboarding department will be like, so tell me what your pain points are. We always want to know why you're calling, right? Mm-hmm. And they'll be like, no energy, have kids, no sex life. The weekends are Budweiser and football.
Yep.
I haven't worked out in years. And they'll go on and on. 40 pounds overweight. I'm at this rinse and repeat lifestyle. And you're like, yes, this guy's going to have a new life. And then they say, I got to talk to my wife. And you're like, oh. I'm like, and it's typically because they have to spend, a few $100s on blood work. And you're just like, you want to pull your hair out of your head. You're just like, oh, God. And you said that you can't be of service to others if your health isn't right. And that rolls back to me. And the first thing I thought of when you said that was, if I'm a husband, if I'm a dad, right? Even if I'm a son of an elderly mom or dad, and I am not the best version of myself or working towards that, those people actually suffer more than me being the guy that's just sitting on a sofa all day but always there, right? I feel like men especially now are losing sight to the fact that they need to be a strong role model, walk into a room with presence, not be shy like a lot of men are these days, and overweight, and not deliver a clear message. Testosterone gives you that. I mean, that's the reason why we're real successful. We changed a lot of lives, men and women. What are some of the, and typically what I say to that person is if you were at your GP right now and they said that we want to test you for some extensive stuff, it's going to cost you $200 more, what would you say? Yes. Of course. But they come here for some reason and it's a barrier, right? What are some of the things that happen with you and that you want people to be very aware about when they call you? Obviously, listen, stem cell is not inexpensive, but it's worth every penny. And when I say every penny, it gave me my life back. I didn't realize this is the first injury that I had where I was essentially almost paralyzed. Everywhere I went, I was peeing myself, shooting pain down my neck, waking up screaming in the middle of the night. They wanted to fuse my neck. I went, had stem cell done, and voila, 48 hours later, I had my first night's sleep. I have sex with my wife for 45 days. I couldn't walk, couldn't run. I'm very active. hunting season was coming along. I'm a diehard bow hunter. That was no way that was happening this season, and it changed my life. And I'm really excited to get down to see you guys, because if I got results from there, I can't imagine the results I'm going to get from you guys. But when someone calls in, what are some of the things that they should be thinking about? And what are some of the things that they should understand will happen after visiting BioXcellerator?
So one of the things that I always push people to do, whether they're doing business with us or somebody else, is to continue to ask questions and educate yourself, because what's happening in the stem cell space is the quote unquote word stem cell is being thrown around as if all stem cells are alike, and they are not. It's not even close. It's like saying that quote unquote cars are all the same. No, you have Ferraris and you have, Honda Civics, and there's a big variety in between those gaps. So my point is just really people need to continue to educate themselves, and more importantly, they have to realize that this is a specialty. So you need to go to the experts and ask the specialists, the stem cell specialists, not just your GP, not just your orthopedic surgeon, not just your neurosurgeon, which, by the way, are fantastic docs. They could be the best doctors in the world in their specialty. But you don't ask a cardiologist about pediatric care. You don't ask an orthopedist about heart surgery. And so what we're seeing is that these great doctors are giving their opinion on stem cell, when the truth is sometimes they don't know what they're talking about.
I saw 3 doctors. All 3 of them told me it wouldn't work.
Exactly.
And
my
guess
point.
what I did? Came back and legitimately went to see 2 of the 3 that I knew well, and was like, guys, my neck is like 95% better. You really should not have deterred me from trying to do that, because if I listened to you and had my neck fused,
yeah,
and I knew that this was a full option after, I would have been very disappointed.
Yeah, getting into the medical space as a non-physician, I really had the same level of respect for doctors, and I still do. But my whole team are doctors, and they're brilliant doctors. I'm not saying I don't respect doctors. What I'm saying is I thought that everything that they said about medicine was true, and the truth is they're just humans. Yep. And they have motivations just like anybody else. They need to feed their family. They need to, be the experts in their field. And so sometimes those motivations, those human motivations, seep through in their medical advice. Meaning, if you have an orthopedic surgeon like you that tells you no, stem cell isn't going to work, they're dead wrong. They're dead wrong. Why are they saying that? That's not evidence-based. We actually have tons of evidence. There's no debate in the scientific community whether or not stem cells are both safe and effective for a lot of conditions.
Well, the question that I asked when I went back, I should have asked the first time, guys, is, can you do me a favor? Can you show me all the research that you've done on stem cells before you tell me not to go do it?
That's great.
That's exactly what I should have said the first time, because I was dying to get back there and being like, the first doc I sat with, I said, hey, doc, why did you tell me not to do stem cells? Oh, your neck is really, really bad, and some stem cells aren't going to fix it. Well, can I see the research that you put in? Like, how many hours have you put in proving this? And he just looked at me. He's like, is this why you're here? And I was like, yeah, this is why I'm here, because I'm concerned someone else is going to come through the door, and there's a solution out there that might not line your pocket, but, you might want to do the right thing, and you get out of my office, And I've known this guy for like 15 years. Yeah. I mean, but.
Don't you think you as a business person, if somebody came to you and said, hey, you were wrong, wouldn't you take a kind of a harder look and go, oh shit, okay, maybe that's something I should look at?
First thing I've done, because I've done that before. I've made those mistakes.
Yeah.
I've made the mistakes on certain meds we have here, where I was like, it's not really worth bringing that medication in. Guess what? When you service one person and you needed that medication and you didn't have it, you just effed up bad, right? Yeah. And that's the reality, because who's to say what's good for everybody? And, we have 3 MDs and DOs, and we have 13 NPs and PAs that work at Core, and they all work as like one big brain. Mm. So when someone comes in, your blood work gets done, your goal sheet gets filled out, the waivers, and before they speak to you, at least 3 people on that board have reviewed your blood work, right? And the reason why I do it is because now one person isn't the ultimate decision maker on your life. There's now 3, and they come from all walks of medicine. So you're getting a lot of diverse information, which is so valuable, and they all learn from each other, right? So like that's why I'm super excited about partnering with you guys.
That's another core, to play on words, for your business, but that's a core competency of ours, and that's another crossover where we do business in the same way. We have a medical staff that looks at and reviews all of our cases. So this is neurosurgeon, orthopedic surgeon, sports docs, emergency medicine. We also have an epidemiology team that looks it over and bases it on other global research to make sure that we're.
I gotta step my game up.
This is the point where I say we spend a lot of money on doing it the right way, maybe too much.
So my name's John Smith. I hear about you guys from a buddy that got some great results, and he thinks that I might be a good fit. Explain what your entire process is for me.
So we would start with a discovery call where John Smith calls in and talks to one of our patient advocates. This is the best patient advocate team on the planet, but they're not medically trained. So this is just high level information to do the discovery. This is where we cover getting your medical questionnaire and how we operate so that there's no questions about the next steps. And the next step is very easy. It's only a telemedicine consult. So we can do that as fast or as slow as you guys are ready, just like or John Smith is ready, just like any other physician or doctor's office. You would fill out a medical questionnaire, and that goes to the telemedicine consult. From that telemedicine consult, we understand your core indications and what you're suffering from, and from there, that's where we turn that conversation, that telemedicine conversation, over to our team to do an evaluation. And this is where we either accept you or deny you. And we're very different in the sense that we will deny you. Most other clinics aren't going to deny you. I would say Dr. Reardon in Panama, they do a great job at evaluating cases, and they're being very protective of the industry as well, where they will actually deny patients if they don't think you're going to see results. And then from there, we schedule your treatment.
So I want to get a little bit more in depth on that. But my first question is, you should always call. You should always call. So even if he says something that you might fall under the category, you should still call and find out if it's a good fit.
Absolutely.
I'm going to say that. But can you give me a few examples of things that in the past that have happened to where they were denied?
Yeah, I would say to use your example, where a doctor might have said, "Oh no, your neck is too far gone. Stem cells are not going to work." We want you to call. We would argue that you should for sure get a second opinion before you go into any surgery, because I can't tell you how many surgeries we've actually helped after the fact, because once you're fused, the disc above and below are eventually just going to be also giving you just as much pain or lack of mobility, deterioration.
Arthritis, yeah.
Exactly. So, we do a lot of post fusions also. But the point I'm making is that we might also look at those images and totally agree with your orthopedic surgeon and say, you know what, they were actually right. You are too far gone. You need to go get fused, and then we'll try to help you after that. So that's something that we do a lot with all intra-articular injections, so knees, hips, joints.
It's amazing that you're sending them back to a doctor that probably would have been like, don't ever call those guys.
For sure.
But the thing is after they're done with the surgery, that should be their first stop.
Yeah, we do a lot of, especially in professional athletics, we do a lot of athletes that, yes, surgery is actually the next natural step, but stem cells right after will help you heal faster. So we have a ton of case studies of athletes that we've gotten back in the game much faster than.
How about before surgery?
No, not typically before, because you're going to just create so much trauma and inflammation from the surgery that it's mostly a waste of money.
Okay.
Yeah, in most cases, not all.
Because for us, we suggest high cell regeneration, healing cells prior to surgery. So we
for sure.
IGF-1, testosterone, TB500, BPC, NAD, all those things pre-surgery.
Yeah, and we would do some other biologic, maybe a PRP or maybe an exosome before, depending on the indication. But mostly it would be other alternative modalities like you're mentioning to help reduce inflammation and to help prepare the body for that surgery and help stimulate your cells to regenerate on their own. But stem cells is so expensive that it would be a little bit of a waste.
So do you ever have a direct conversation with the orthos or anyone that your clients are working with?
Oh, yeah.
Yeah. Can you talk to me a little bit about how that relationship works, what the differences of the orthopedics or the surgeons that are understanding the medicine versus the ones that aren't, and how well you guys work together in that situation?
Great question, Sid. I'm glad you brought that up. I usually don't cover this, and it's super important because as much as in the earlier part of this podcast, I'm kind of demonizing, the typical modalities of medicine.
Yeah, no, I mean, I think it's really fair. I mean, we've both dealt with a lot of trauma in our space.
Yeah.
Right. I mean, how many people, I mean, I've had people telling me I'm killing people after I get a phone call from a spouse that said my husband had a gun in his mouth 6 months ago. You just saved his life. So who's that person to tell me I'm killing people? Because I'm saving lives too.
Yeah.
It's not my fault if your husband's drinking, doing cocaine, and also wants to take testosterone and not tell me about it. You know what I mean? Like, I mean, that's a problem. When people aren't honest with us and we prescribe to them, it's a problem.
Yeah.
And I think you're spot on, because I think the majority of the physicians would be a lot better off, and their practices would excel a lot more by bringing in some additional options for their patients. So yeah, please take over.
Yeah. So, as much as I have an issue with the way that American medicine is being administered, we also have great physicians that are great referral partners for us. They sometimes come down to Columbia with their patient just to be educated a little bit more deeply on it. We have a healthcare provider program where we invite physicians once a quarter. These are typically top physicians already in regenerative medicine in the United States that are still just doing the lower level bone marrow aspirate or adipose tissue extractions. But we have a lot of educational components to getting physicians trained in our specialty. But we also have physicians, especially on major sports teams, that are actually very progressive and are sending patients to us. They're saying, you know what, don't do the surgery yet. The surgery is going to take you out of the season. The surgery is going to make you, have a 12-week recovery. You might not get back into next season. You're not going to get that next contract. Try stem cell first. And so we have a lot of physicians that are actually progressive in sending us patients.
I mean, the common sense for me well, before I get cut, my life changes permanently. Why wouldn't I go try this?
Yeah. I mean, look, I understand that money is a barrier, of course. But is it a barrier, instead of getting a new car this year or going on another vacation?
Spending $14 a day in Starbucks.
Or $14 a day in Starbucks, exactly.
I mean, that's like the magical number I see on my American Express from my wife on a daily basis. It's like $14.62. It's the same shit every day. It adds up. I mean, how important is your health? And I mean, for me, I was blessed when I went down and got the stem cell done. I had the financial ability to pay for it. And what I can tell you is, if I didn't have the money, I would have done anything in the world after that experience to find the money. Yeah. Because it gave me, I learned so much gratitude from that big injury. I mean, it really changed my entire life. Like, everything changed immediately.
You just brought up something that happens to me a lot, that happens to us a lot. A lot of times it'll be the spouse, the wife, that calls and says, hey, I really need to look into stem cell for my husband. But the best part is that this has happened a couple of times to me, where a wife has either been in Medellin or emailed me or called me or something and said, hey, I just want to thank you because you helped save my marriage. And I kind of look over my shoulder. I'm like, are you talking to me? What do you mean? But they're like, no, my husband was a prick, and he was in pain every day. But it was about to dissolve our marriage.
Happens a lot with the high-end operators. Like,
yeah.
They're so taught to just stuff the pain. Tylenol, cigarette, get after it.
Yeah.
And then they come back to the States and they're living in so much pain, and the people closest to them suffer more because of that whole effect of your body being in pain. It's affecting everything, the endocrine system. There's so much pressure. I'm a big fan of the stellar ganglion block. I don't know if you're familiar with Dr. Lipoff, who actually designed the new protocol for that's a doctor here at Core Medical.
Oh, okay. I didn't know that.
He's fantastic. I should definitely connect you with him, because he's another level. He actually has a treatment center down by you.
Oh, really?
Yeah.
Okay.
Yeah,
yeah, please connect us.
And I did the Stella block because I didn't realize that my brain was causing me to be under so much stressor that it was rolling over into my body and causing inflammation, making it hard for me to sleep. And I came back from doing stem cell and went immediately and had that done. And my sleep score went up 20%. My REM sleep went up 40%. And talking about all the different ailments that we're discussing right now, you and I are under the same belief we're stronger together.
Oh yeah.
Right? Even though we might have to lose a little bit of income, but it provide an amazing experience and get results, we're stronger together by offering these packages that we're going to be pushing out here shortly, which I'm super excited about, and so is my team. But before we get into that, I just have a few questions. I really want you to roll with this and really educate. Talk to me about the difference between the stem cells that you can get stateside or the stem cells you can do legally stateside and the stem cell treatment that you can provide overseas.
So the question is going to make me back up just a little bit into the history of stem cell.
As much information as possible.
Okay, perfect. So, stem cell therapy was demonized in the early 2000s, mostly by George Bush, and it was relating to the sourcing of stem cells through the embryo or embryonic stem cells. And, I think that demonization was actually good for the industry in the sense that that was early science and there's inherently a little bit of an issue with embryonic stem cells. Not only the controversy of the sourcing, which is just disgusting and nobody does that anymore. And so thank God that that's behind us. Meaning, there's like aborted fetuses and, it's just really trash sourcing from some companies.
Can you just touch on that a little bit more? Like what was that process so we understand?
Yeah. So I think that, now this is before I got into the business, but I think that there were some companies or scientists or research laboratories that were going to like Planned Parenthood and sourcing abortion tissues for the science to do the research. Now, this was long before they were injecting them into humans. I think this was a pure research, prowess. But it's controversial. It's terrible. It's terrible to even continue to condone that. That
whole process.
All. So, so for that reason, it's great that we as a scientific community had to look away from that type of source. And again, this is long before our company existed. So the transition then made scientists look into other sources of stem cell. And so they found it in adipose tissue, so like fat, right? They also found it in bone marrow and then also umbilical and perinatal tissues, which means, so like for our company, we get it from the umbilical cord, but there's no controversy. This is a healthy mom, a healthy baby. They go home and live long, healthy lives together. But instead of throwing that umbilical cord away, donate it to scientific companies where we're able to help hundreds or thousands of people with that.
How much does that? How many stem cells do you get out of that one umbilical cord?
So it depends on the process. What we're seeing, this is actually getting into some of the kind of junk science that we're seeing in the United States. So even though you're starting to see this transition in the United States to a better, more advanced type science where you get the sourcing of the umbilical cord. So that's better than what we've seen over the last decade.
Okay.
In the last decade, it was adipose tissue, it was bone marrow aspirate, which is an okay science. I'm not saying that that's not okay, but it was very low level. And it was the only thing that was allowed here in the U.S. So people that have been getting stem cell in the U.S. for the last 10 years have been getting ripped off, in my opinion.
So they're basically, what's going on is a physician's going in, they're drilling into the hip bone.
They're puncturing the iliac crest and sucking out a bunch of bone marrow.
Then they're going to take that, they're going to spin it, put it back into a blood or a...
They might put it in a joint. They're just repurposing all of the stem cells, all of the cells. So it might be hematopoietic cells and some other type of mixture of cells from the bone marrow. And they're repurposing it to, let's say, a joint. So if they had a shoulder issue, they would just stab you.
And I would like to believe that if someone is not promoting high cell regeneration through the pituitary and the cells in their body are compromised, that the service is probably not the best option.
Yeah, they're coming to you because they're not healing from an injury, which means they're
using their body to heal the injury. Yeah, simple. Okay.
Yeah, so it's like, and depending on how old that patient is, their cells have been exposed to that environment for decades. And so they're not the healthiest cells
that's
anyways.
Amazing. That's I never even thought about that.
Yeah, so
it's so basic, but so true. Wow.
So this is what's been going on for the last 10 years. Now, luckily, thankfully, there's a lot of companies that are willing to break the law. I'm saying it that way because we weren't willing to do that. That's why we're forced offshore. But now there are a lot of companies in almost every state that are breaking the law by injecting umbilical cord stem cells. Fine. They're in my opinion, they're still trying to do the right thing for the patient because this should be an option. But what's happening is a couple of things that are making those cells junk. And whether it comes from a great laboratory or a terrible laboratory, both are still junk. And the reason that I'm saying that is that let's say the great laboratory that's ISO certified, that's FDA regulated, that's doing a great cell manufacturing process. A lot of times when they're mass manufacturing, they're taking that umbilical cord and they're putting it they're emulsifying it, they're blending it essentially, which is harming the cells for one. It's also taking a lot of the umbilical cord that is not necessary. And to get back to your question, they're doing that so that they can harvest as many stem cells as possible, so that umbilical cord stretches and makes a better business for them, but it doesn't make a better outcome for the patient. So in our process, to answer your question, one umbilical cord could help hundreds of people, but we take a 2-inch by 2-inch piece of that umbilical cord called Wart and jelly, which is the most effective, pure, and potent area to get mesenchymal stem cells. And we throw the rest of the cord away. Now, you can do some scientific manipulation to that 2-inch by 2-inch piece to make those cells last or multiply for a lot longer. But we also stop at a very specific area of passages, in between specific passages that we know are most effective for the things that we're treating. And most companies don't do that.
That's insane.
Because it's very expensive, and it really is only looking for the outcome, not the sale.
So your business model is be as highly effective as humanly possible for the residual business and the best outcome.
It's to protect the industry. Yeah. It's really, we're growing an industry. We're pioneering an industry. And so, the moonshot goal here is to change the way that American medical system treats patients. So it's preventative, it's personalized, it's proactive, which is completely opposite of what our American medical system does. So we're spending the extra time, effort, energy, money, resources to protect the industry, to grow the industry, because what's happening at these other laboratories is they're running their labs like a business. And they have to, I get it. But if you look at it this way, the laboratory is just like any other business, where they need to increase production and decrease cost. That's just business. So they do that by they increase passages, they multiply them further, they emulsify and blend the entire cord. They're doing everything they can to increase production, and then when they decrease cost, they're using inferior products that are safe. They're not going to hurt people, but they're not good for outcomes. So they use this culture expansion process with culture media that's just cheap, it's inexpensive, and then so they're getting this high level of yield with a low cost. And then they're shipping those cells across the city or across the state or across the country. And we know that outside of that laboratory environment, cells start dying within an hour. And so now the cells, by the time they get to a good physician that's trying to do the right thing, that might be working with a good lab, they're injecting patients with something that is a very inferior product.
So one of the biggest things that I think the audience is going to want to understand is this. You have mu cells, you have stem cells, you have exosomes. There's one more, right?
Yeah, we have secretome product also. We do a very high level PRP. Yeah, we have several products.
Can you touch on those and kind of just give a broad idea of what they do and when they should be used?
Yeah. So we have a legacy stem cell product that's our mesenchymal stem cell that is not Muse-like. This was not a stressed product. So the Muse-like cells are the ones that are really highly stressed in the culture process. So we take these cells a lot of times in a hypoxic cultured environment. So the stress part, which is essentially what this company, Muse, has done a great job in protecting from a trademark perspective. But really, companies like ours have been using that type of culture process for many, many years. Mm-hmm. And it's really stressing the stem cells in the culture process. So we use a low oxygen environment, a hypoxic controlled environment. And so that's a separate product that we use mostly.
Is it very expensive?
Yeah.
You use like 3 times the amount of a stem cell?
Yeah, you have to, the process to get a good stressed cell is very expensive.
But worth it.
Of course. Okay. Yeah. We see fantastic results. And we've been doing that for the better part of a decade at this point.
You guys have.
Oh yeah.
Because I've talked to some other people, they're like, "Oh, I just got the latest and greatest stuff now. It's called these moo cells or whatever."
Yeah.
And I'm like, "Oh, okay."
Yeah, no, they've done a great job. That science is sound. That's Dazawa out of Japan, and the science there is very sound. The problem I have is that they're selling their cells. They're shipping them across the country. They're shipping them across the globe. They're a laboratory that is mass manufacturing. Again, no problem with that as long as they're doing the right process inside. But then the problem lies not with that laboratory or that product, but it's when you ship it across the city or state or country and you do it on dry ice, which is like a 200-degree differential from cryopreservation. But then you put it in the hands of a non-professional or non-specific stem cell clinic. This is a practitioner. It might be a great orthopedic surgeon that is awesome at injecting intra-articular injections, but they don't know how to handle those cells, and they don't know that those cells are probably dead when they're injecting them or very, very low viability. The testing that we've done is somewhere between 5 and 20% viability, 20% at the best, 5% in most cases, 0 in a lot of cases. We guarantee 100%. And this is the biggest thing that I think patients should look for is there a laboratory that is making your cells and also injecting you in the exact same facility, because that means they're actually a scientific facility. They're actually a stem cell company. They're a vertically integrated company, not just an injector that is buying cells from a laboratory. It might be great cells like mu cells, but once you ship them out of that laboratory, they're gone.
Yeah, we've seen certain meds that we have here that definitely over time potency, sterility, all that stuff comes into play.
Yeah.
And that makes a lot of sense. Can you talk about the exosomes with the stem cells as well too? Because that's a big thing here in the United States right now. Number one, what are they used for? What's their claim to fame? And number two, what's the difference getting it here and getting it overseas?
Yeah, good. I'm glad you went back to that because I kind of jumped over that. So this is actually one of our core products. We have something called NovaCell, and it's essentially the combination, or it's NovaCell Plus. It's the combination between our hypoxically controlled stressed cells, Muse-like cells that are combined with exosomes. Now, exosomes is an extracellular vesicle that is secreted by the stem cell. So stem cells alone are really the brain. More or less, and the exosomes are the master signaler. Now, the stem cells also have signaling molecules, and they secrete other growth factors, cytokines, exosomes, but the two together have this incredibly potent effect in both reducing inflammation almost immediately. So people that are getting joint injections, we see an immediate drop in inflammation, and that means an immediate drop in pain, immediate improvement in range of motion. But then those exosomes are signaling the microenvironment of what we're injecting. Mm-hmm. And so they stimulate your own body to immediately start doing the repair. Stem cells have a similar mechanism. There's actually, Dr. Arnold Kaplan, who has recently passed, was really the godfather.
I was just going to ask. Yeah, I thought he just passed away.
Yeah, he's the godfather of stem cell, more or less, in the sense that he found the mesenchymal stem cell, or mesenchymal stem cell, depending on what part of the world you're in, how you pronounce it. But which, by the way, my co-founder, the brilliance of the operation, our chief medical officer, she won the Arnold Kaplan Award many years ago in stem cell. But anyway, the point is that he kind of made an apology to the industry and said, I shouldn't have really called them stem cell. I should have called them signaling cells, because really what they do is they start signaling your own body to wake up and come to this area and start stimulating massive repair.
So someone explained it to me not too long ago that went down and had stem cell done. I believe it was with you guys, that the exosome is like the lighthouse for the boat.
Ah, yeah, great. That's a good analogy. I love that.
Yeah, and it basically is, if I might be wrong here, that ability that exosome has is now drawing the stem cells that you're putting in your body after the exosomes to go to the infected area, and also causing your body to push more stem cells to that area. Is that correct or is that incorrect?
It is kind of, depending on the indication and depending on when we prescribe the injection. For instance, we have our Evoke product, which is extracellular vesicles, the acronym. But the Evoke product is our exosome product alone.
Okay.
And that's something that we can inject without stem cells. Now, we do a combination in most cases because we've just found light years more advanced results, even when we're using Muse-like cells or like our top line cells. If you combine that with exosomes, it's insanely effective. So we do the combination mostly, but we can send this exosome product into the United States and have patients pre-treated with exosomes. Sometimes that's all you need is the exosome because it's a master signaler. And it signals the microenvironment. So it senses your microenvironment to stimulate your body to continue to repair in the way that you were supposed to do when you're deficient in.
So there's obviously always situations where it doesn't work, right?
Of course,
there's always, it's medicine, right? What is the process? Let's just say I come to you for my neck injury, right? People really need to understand this because you need to follow the rules. Like you're spending a lot of money on stem cells and there's a lot that goes into their protocol. I can tell you right now, I'm in the middle of it because there was a point where I was like, this is over the top. I understand it, but like, and I'm grateful for it, but I'm like, I'm putting myself in my patients.
Yeah.
And they'll be fine with it because we'll educate them prior to the fact of like, look, these guys are no joke. You need to do exactly what they say if you want the results that you want. But when you get your stem cell to the point of finding out what the results are going to be, what is that, 2 to 3 weeks typically?
Of finding out what the results should be or
yeah, like when you start to feel the relief. I got relief within 48 hours, a lot of relief because I was in bad shape.
Yeah.
But I have to go back every 6 months as we spoke about for me to really feel my best. When should people start to see the magic after they go into BioXcellerator?
We set the expectation at around 3 months.
3 months.
Yeah. We do. Now we see professional athletes and guys that are in tune with their body like you that see very immediate results, especially when it's a compression issue with the disc. And when it's a spine and disc, we see almost immediate results because a lot of times if it is a compression issue, just the fluid helps decompress it and relieve some pain. But then there's an arc there. So, sometimes it'll decrease pain immediately, but then that'll kind of come back a little bit and plateau, and then it'll drop again. So it depends on exactly what you're asking for, or asking about, which indication. But I would say that, the clinic that you went to before where you go back 6 months, we wouldn't even take you back in 6 months because if you're doing it right, it should continue to increase for a year, and we won't revisit for another year because the risk of injection versus just waiting it out a little bit for the regenerative process to continue to go, we wouldn't put you at risk again within that same year.
Well, that's interesting because the thing that you just said about the fluid was exactly what I was thinking when I had that immediate result.
Yeah.
And then it like died down.
Yeah, that's just a compression issue.
While we're on this topic then, what should people look out for when they're trying to pick the right stem cell clinic? I know one of them is making sure that they're all encumbered, that they have a lab along with the injection, the OR. What are some of the red flags that people should really take into consideration? Obviously, I just learned one. So can you kind of point that out? I think that's very important. Like, maybe someone lives in California, they want to go to Tijuana and they find a place down there, whatever that might be. Can you educate the people on when they should really be concerned and what they should look for immediately upon first interaction?
Yeah, I'm going to highlight what you've already said, and sorry to be repetitive, but this is the most important thing. If you're not working with a clinic that has a laboratory that controls the science and the production of the cells, you're actually just working with a broker. You're not working with a clinic. You're working with brokers. And that's not inherently bad, but that would be the number one indicator. So that's a good clinic. And it's not, there's other clinics like mine that have vertical integration, mostly. So I would look for that. But if you can't do that because they're too far from wherever you are or too expensive, then the things that I would look for are the results. So really in stem cell, yes, it's expensive, but what you're paying for is a guaranteed pathway to viability. So you want to make sure that your cells and what you're paying for are actually going to be injected into you. So you want to look at how do they protect their chain of custody. So if they are buying cells from, let's say, from Japan and shipping them over here to the United States, who controls that chain of custody? How can you prove what has happened to that shipment from the minute it left the laboratory all the way to you, and then all the way from the doctor to the injection? So if they can't prove that, that's just telling you, again, you're working with brokered cells, which, again, it might be okay if they control that chain of custody. And then after that, how did you research the results? Are you just injecting people every day because the laboratory says it's good cells and because you heard on a podcast that some influencer got good results? Which, by the way, that's okay too. You should listen to those guys because testimonials are that's people's lives.
Yeah.
But how do you prove it? So let me see your results. Let me see your tracked outcomes to see that the cells and the process that you use is actually getting good outcomes. Not just like, oh, I have the best cells. I'm using the same cells as everybody else. I'm using mu cells. By the way, again, mu cells, the science is actually very sound. But once it gets out of that scientific laboratory, it turns into junk in most cases.
I think the first question I would ask is say, hey, can I see your data, please, for the last 2 years on the same issues I'm coming to you for?
Exactly.
And I guarantee you that's going to weed out 98% of the places because they're not going to have the data.
Exactly.
It's the same thing here. I'm super data driven. That's
Yeah.
why, when I talked to you, I was like, oh, I don't even have to ask this guy if he's data driven because he's definitely data driven. But
yeah, we can pull up and we can say, okay, here's a cohort that resembles you. This is a 45-year-old guy that had a shoulder issue and it's because of jujitsu, and we've treated 800 patients kind of like that, and here's the results. Some of them, by the way, got no results. Let's be honest about that. Yep. It's medicine. There's 20% of people sometimes that just don't respond.
Uh-huh. So where right now do you see the United States accepting this in the near future?
Yeah, good thing that RFK is really shaking up the way that we're looking at medicine in the United States. Everything from food dyes to glyphosate and everything he's doing. So this isn't to be political because there is no politics in health. That it shouldn't be a right or left thing, which it's crazy that it is.
Yeah, I remember whenever anyone talks about this, I have to say this. I remember when I was a kid, man, didn't matter what side of the scope you were on, we all loved each other.
Yeah.
And now it's just become so divided and it's real sad.
Yeah. Yeah. When I bring up RFK, all of a sudden it's a divisive conversation. No, actually, I'm talking about how he's trying
forget
to
about the
health.
Pretend he was neutral and he wasn't on. He was just.
By the way, he was a Democrat two years ago.
Exactly. But he's very educated.
Yeah.
He's so educated, and he also holds a lot of credibility.
Yeah. So just from a pure looks perspective, you can tell that RFK takes care of himself. He's somebody that is into health and has had to focus on it for decades. Mm-hmm. And if you put that in comparison to some of the other people that have been running that organization, you just visually you would take advice from him over somebody else. But setting all that aside, he knows about peptides. He knows about the food pyramid. He knows about glyphosate. He knows about the dyes. He knows, we could go on and on and on. Yeah. Getting back to stem cell, he is also very bullish on stem cell. He understands that there has been a demonization of stem cell. There has been a probable intentional slowdown in the way that we're able to bring this to people in the United States. So, we think that he's going to be a good voice for us. Uh-huh. But the truth is he's got his hands full doing other stuff. So, to get to your question, thank goodness there's a couple of states in the union that are going against the FDA. Mm-hmm. So Florida and Utah and soon to be Texas and Arizona and some other states are saying, no, FDA, we know this is safe and effective for our constituents and we're going to give them access to it.
Well, just like the marijuana business.
Yeah.
It's very similar to that. I'm not the biggest believer in everyone should be able to smoke weed because it's really hard to hire these kids these days. But that's a good step in a great direction. So audience, I will be attaching some really interesting information on BioXcellerator, as well as Core Medical, of how you guys can take advantage of both medical opportunities. We're really excited to push this out here. And Eric, dude, thank you so much. I appreciate you so much. All your hard work and sacrifice goes a long way.
Yeah, same for you, man. I mean, we're in the same space, but I appreciate you being so, so gracious with your time and also with bringing us into not just, talking about it with your audience, but also with, your patients and seeing how we can also help you. And this is something we said in conversation, but we refer a lot of people, and this is not our core competency is HRT, TRT, but we know that this is a natural step to getting into better health. So thank you for what you're doing, bro.
Thank you.